Next on Primary Care, dying before their time. Every year, more than 1,600 adults in Detroit and surrounding areas die before their time. Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, the show dedicated to improving the health and care of African Americans. In Detroit, a city where nearly 80% of the population is black, the death rate for people ages 50 to 59 is 122% higher than those of the same age in the rest of the state of Michigan. And for people ages 60 to 74, the death rate is 48% higher. These statistics come from the report Dying Before Their Time, a 19-year study commissioned by the Detroit Area Agency on Aging to understand why so many Detroiters in their 50s, 60s, and 70s are dying too soon. Here to talk about the findings of this report is Ronald Taylor, President and CEO of the Detroit Area on Aging. Ron, welcome to the show.
Thank you so much, Dr. Joe. Thanks for having me.
So glad to have you. This has been a 19-year study which was prompted many years ago. Can you take us back a little bit and set the stage on how this was all developed, this Dying Before Their Time report?
I can. I wasn't here at the time, but my predecessor, Paul Bridgewater, I have to say he had a brilliant thought or idea as related to trying to evaluate and to study what the causes as far as some of the loss of senior population in our community. So Paul originally believed, according to what I've heard and my conversations with him and also with Dr. Smitherman, Paul originally believed that our population loss was due to out-migration, but it was occurring at such a rate that was somewhat alarming. So Paul got with Dr. Smitherman, who was with Wayne State University School of Medicine, and some of their researchers to take a look at what were some of the causes or what was the true impact for some of the population loss. And one of the things in which was discovered was it was a startling fact is that the out-migration was one consideration, but another strong consideration or effect or cause for the loss of population was in regards to the number of individuals that were passing away before their time or the excess mortality that was taking place in our community. So that led to the commissioning of the report Dying Before Their Time and our continued evaluation and studying of this phenomena and issue.
So 19 years have passed, and you were at the point on seeing the third rendition of this report. Are there any comparators at this point? What has changed initially since the initial report as compared to now?
Yeah, unfortunately, Dr. Joe, not much has changed. The third report has validated or continued to underscore the fact that our population and our seniors are passing away at a greater rate than their colleagues and their cohorts throughout the rest of the state of Michigan. So that's an alarming fact. If there's one glimmer of hope that the report contains, is the fact that the younger age cohorts within the study, I would say those that are 40 to 50, the excess mortality rate has somewhat declined. But as related to the other age cohorts, it has remained constant, if not increased slightly. So that's the unsettling, and that's the issue in which we have to continue to advocate about and to raise the bell or raise the alarm.
Ron, when we look at this report, one thing that stands out from edition to edition is the geographic differences, which are devastating. Obviously, this has an effect on this entire community.
It does. And, and a lot can be said. A lot of folks have come out, the World Health Organization has come out and indicated that you can somewhat predict the health outcomes of an individual or the life expectancy of someone based upon the zip code in which they reside in. And, that's unfortunate in regards to some of the issues in which we're seeing as far as the quality of life and the health expectancies and some of the disparities that arise. Dr. Joe, there's some we've done some other studies, and just within our communities, we serve the communities of Detroit, Hamtramck, Highland Park, Harper Woods, and then also the 5 Grosse Points. And if someone resides in the city or in Midtown Detroit, their life expectancy is 69 years of age. But in comparison, their colleague who may reside in the Grosse Points community will have an additional 13 years of life. So you're talking about if you travel 10 miles, there's that difference. It's related to the life expectancy of an individual.
10 miles.
10 miles from Midtown Detroit to the Grosse Points.
But Ron, these percentages are staggering. It would be nice if this was, our investment portfolio, but it isn't. It sounds to me like somebody's investing in death.
Well, I never looked at it that way, but when you take a look as far as our history and systemic racism and some of the issues in which have come forward, I think it raises a lot of questions, and I think it raises the question of how come we have not responded, or what must we do to bring this equality or to make things equal for all. And it does appear that there's a separate but unequal system that's at play.
The report also uncovered some other things, some additional disparities, so to speak. Would you touch on those a little bit for us?
Yeah, some of the disparities in which we saw was in regards to access to care. Our region or our population, probably 2/3 of it is what we would call as far as a health professional shortage area. So essentially what they're saying is that there's not enough doctors, there's not enough dentists, there's not enough psychiatrists, there's just not enough healthcare professionals available to, that's not 2/3, I want to say 94%. There's just not enough professionals available to provide the services that our population needs. The second fact is that probably 2/3 of our community is in what we would call a medically underserved area. So that means that the facilities and the resources are not just available for our community to access care. Another startling fact of this study that came about was that approximately 89%, or I would say close to, we have about 150,000 individuals 60 and above in our community. So approximately 135,000 individuals are dealing with one chronic illness. But what really was startling was that approximately 40%, or close to say 60,000 individuals, were dealing with 3 or more chronic illnesses. Now that is alarming when you're thinking about the fact that somebody may be dealing with cancer, hypertension, and then also dementia or a stroke victim, or any of those chronic illnesses that are prevalent in our community. So that is an alarming fact as related to the quality of life and the care that is needed for our community and for our population.
That's very important. I've seen statistics that show that the average Medicare recipient in this country has 5 diagnoses that were billed for during the course of their care in 1 year in 2019. Alarming numbers. Ron, we're going to have to take a quick break. We'll be right back with our Black Lives and COVID series. You'll be hearing from a Detroit woman dealing with the untimely death of both her sister and her brother. Stay tuned. We'll be right back.
Our dear fellow Americans, vaccines are a huge step forward. We still need to do the simple things that we know work.
Wear a mask, wash our hands frequently, and maintain social distance.
Now it's up to you.
Buncell Brown Miller, who lives and works in the city of Detroit, lost both her sister and brother within months of each other during the COVID-19 pandemic. Her sister was 65 and her brother was 59. In today's Black Lives and COVID series, you'll hear Ms. Brown Miller reflect on the early loss of her siblings during this unprecedented and trying time.
When COVID first hit, my sister and our family was dealing with my sister Vanessa, who went into the hospital July of 2019 with what we thought was some heart issues. She had issues with breathing. You know, the doctors came to us and told us there's nothing we can really do for her. You know, you should just say your final goodbyes. And so we were like, well, what's wrong? And they were like, well, we're not sure. Well, I said, you can't tell me to step away and you not be sure what the situation is. So fast forward 9 months after being in the ICU on ventilator, came off the ventilator twice, went into rehab, ended up back in the hospital. And we thought this was our reprieve to, you know, maybe really, you know, get her into some good care. She was fully conscious. She seemed to be rallying. Her desire was to live. My sister and I had said, you know, I can remember us walking out of the hospital and saying, we should just come get her. You know, we could just come get her and take her home. We can bring all those services to her. And if these are her last days, she'll be at home. And on our way to the elevator, the nurse stopped us and said, starting tomorrow, only one of you can come. And we were like, why? And they were saying that there's a virus going around and they're gonna shut the hospital down. And we were like, whoa. So the next day they called us and told us not to come because there would be no visitors. So we were like, well, then what are we gonna do? Because we need to be there. We know the kind of care she needs to receive. And we're not sure that she's gonna get it if we're not there. And so what was happening? Decisions were being made as to which patients should survive this and who needed the equipment. And they were taking these things away from her. So maybe a week later, we got the call and said, we're resuscitating your sister, she's not responding. Now we have this health crisis that she didn't have the privilege to make it through because she wasn't looked at as someone that could survive. So that was one thing. And then, so she passed, we saw her on March 13th, she passed on April 14th. And so that was really devastating for us. And in December, my brother, he was supposed to have a heart procedure. So remember just in, right after Thanksgiving, there's the surge and they shut everything down again. Well, he was supposed to have a heart procedure and he didn't have it, they postponed it. And they opened everything back up maybe about a month later. And on December 15th, he had a massive heart attack and he died. Well, that's one that I just can't even fully take in. That was my youngest brother. And we knew that he was having some issues, but not to that extreme that would, you know, take him out like that. And even with my faith, I have those days that are just so sad and hurtful. And so, you know, I still feel like there should be something that I can do for the community. And I feel like even doing this interview honors my sister and brother, Vanessa Ventura, Rex Brown. So we love and miss them.
Our thoughts and prayers go out to Ms. Miller for the loss of her siblings during this most difficult time. Ron, we know that during the height of the pandemic, blacks in Detroit represented about 75% of the COVID cases and about 90% or maybe even more of the deaths. What was it like trying to run an organization like yours, which is so vital to this community? What was it like trying to run this organization during this time period with this increasing numbers of seniors who were dying, and many of them, unfortunately, were dying alone?
Yeah, it was, it's easier to sit back and reflect on, what we were actually able to do. But I have to say that because of our commitment and our passion to serving our seniors, one of the things in which we wanted to do was just try to really figure out what could we do to be a part of the solution and to be a resource for everybody that was involved. And as we got to understanding what the true impact was, it really became an effort to galvanize and to bring all of our community partners together to make certain that we can get the appropriate resources to the individuals, whether it was grocery shopping or the provision of meals, ensuring that they could be, especially those that were socially isolated and that had lost their sense of connections to the community, making certain that we can keep them engaged and keep them connected and let them know that they were not forgotten and that they were loved. So it really became what I'll say is it was a trying time, but it was also probably one of the outside of the pandemic and what folks had to go through. It was also probably a great experience to see the resolve, the community resolve, and the community investment, and then also just the energies and efforts of our team members to make certain that we were there and that we can provide the support that was necessary. But in reflection, I had to say it was a stressful period, but also a very rewarding period for those that were involved in the provision of services.
The organization certainly has to be commended over and over again for not only the initial report, but the follow-up and the follow-through that has taken place, especially in terms of some of the findings of the report itself. You mentioned earlier that not much has changed. Can you dig a little bit deeper into that for us and highlight some of the disparities?
Yeah, some of the disparities in regards to the fact that individuals are continuing to pass away at as far as the excess mortality rate is still twice the rate as far as the individuals or their colleagues throughout the rest of the state of Michigan. That has to change. We cannot continue to accept or not dig deeper into the causes or the effects as related to why our community and why our population cannot have the same life expectancy as their colleagues in the rest of the state of Michigan. The other factors in which I would say that continues to stand out, which I think is something that really has to be addressed, is in regards to the lack of health professionals within the Detroit community. To say that you would have that 94% of our region is lacking health professional services or there's a shortage of such, that's a significant barrier, a significant issue in regards to maintaining or receiving the appropriate preventative health care, which is necessary to avoid some of these issues that can impact the longevity of life. And there was a term that came up in this study. It's called ambulatory care services or care services, which essentially says that if you provide preventative care or if you could get the access to care to some of these issues early on, that many of these things may be prevented. So I think those are some of the things in which we have an opportunity to address and to fix.
When you talk about solutions need to be intentional, what do you mean?
The solutions need to be intentional in the fact that they has to be purpose-driven, and it has to be not just a short-term commitment or not just a commitment to meet the flavor of the day or the moment of the time, but there has to be a commitment that's going to be sustained over a period of time. And that's what I would say as far as intentional. I would say it kind of alludes to the fact that if you're on a diet, it does no good to be on a diet for a week and maybe lose a pound, but then the following week you're off and you pick up or you gain 3 or 4 pounds. So our energies and our efforts has to be sustained, and there has to be a long-term commitment, and we have to be purpose-driven and such.
Talk a little bit about how you see the solutions, and including that, who needs to be the partners in doing this? I mean, we've got major universities in this area, we've got major organizations, we got the philanthropy going on. What does the team look like? What does the team consist of to ensure the success that we need in the future?
And Dr. Joe, that's a great question, and I would say that when we take a look at it, if we're truly going to come up with a solution, it's going to take all what I'll say segments of the community to be at the table, and it's going to take a community-wide effort. And that would include various industries and entities, and such as far as your education system, your business, your governmental, the utilities, your food industries, your healthcare systems. And it's going to take a community-wide lift for us to begin to address some of these social determinants of health. And I don't think any one entity or any one individual will be able to achieve or to help mitigate some of the factors or some of the issues that are before us. But if all of us come together and collectively put our oars in the water going in the same direction, then I believe that we can make some movement as related to eliminating some of these quality of life issues that our community is facing.
What areas of public policy would come into play in terms of making change?
Yeah, as far as public policy, one of the things in which there's a couple issues, and one I would say is that we really need to begin to take a look at things across the lifespan. When I say taking a look at things across the lifespan, it's what we're doing. To me, is at this particular point in time, we are trying to treat the issues or the illnesses that our population is facing. And if we're going to extend, or if we're going to improve, or if we're going to reduce the number of chronic illnesses in which our community is dealing with at a later point in life, then we need to do things earlier in the lifespan to kind of address or to rectify some of these issues. So we're going to need to try to raise the health literacy and also provide more preventative services instead of treatments. I also would say that from a policy perspective, we need to take a look at as far as how funds and resources are allocated to communities. And I say that in regards to a lot of the funding formulas or the allocations of resources is based upon population. And, that's not always the best gauge as related to providing or meeting folks where they're at, or addressing those that are in the greatest social and economic need. So I truly believe that need, or we see it occurring with the allocation of like the COVID-19 when they utilize the social vulnerability index. But need needs to be more inclusive in our allocation process as far as federal and state resources to communities and also to states. Another item in which I really believe that needs to be taken a look at is that it's often overlooked, but I would say the role of caregivers. Caregivers to me are the backbone of the healthcare system. And I say that in regards to they're generally providing the care at home, and while that individual may be recovering or also dealing with whatever some of the issues that may be, we need to do more to provide support to our caregivers. And so that would be another issue, another concern in which I would just say that and I know President Biden alluded to it as far as enhancing the support that's provided to caregiver, but we need to make certain that we're intentional about that support. And one of the last items in which I'll say, Dr. Joe, that really is a priority or is a point of contention for myself, and I believe it will help us in regards to the access of care, is that we really need to improve or to increase the amount of resources of funding that goes towards community-based organizations and for services and programs, so that we can meet individuals where they're at, and that we can provide community services within the home, and also to help bridge that gap as related to the access to care and access to services.
I am so glad you mentioned the caregiver aspect of this discussion, because it is very, very important. It is one of the fastest rising areas of concern that we have in primary care, if for no other reason than that when the caregiver gets into trouble, can't provide the service, gets ill themselves, gets laid off work, it represents a constellation of problems that affect directly the care of that patient. And in a lot of instances, I and my colleagues begin to lose patients to those types of issues that were not present or not as present prior to the caregiver addressing their own situation. So it becomes very, very important that we include the caregiver and the same discussion as the care for the patient. It's like mental health. For years, the medical community tried to take the mental health situation and take the head off the body as if it wasn't part of the total care of the patient. It has to be part of the total package, or else we are destined to fail in terms of our ability to help patients. Ron, we are really out of time this time. I mean, and this is a genuine discussion. It's been a pleasure having you, and we will do this again. Thank you so much for being our guest today.
And thank you for having us, Dr. Joe.
Great. Ron Taylor, President and CEO of the Detroit Area on Aging, has been our guest today. For Primary Care, I'm Dr. Lonnie Joe. Thank you for watching.